Good morning. I'm doing my practicum at a facility through Mountain Comprehensive Care in Prestonsburg, Kentucky. It's called Riverside. It currently houses 8 people. There's 8 beds available, 4 for women and 4 for men. Right now, they have 6 patients who are currently there, and there's actually 3 women and 3 men. It is a very, very, very nice facility. My practicum supervisor said that the state had come in and done an evaluation a while back and said they'd been to hundreds across the state and that this is one of the nicest ones they'd ever been to. They have someone hired on staff who does their cooking. They cook 3 meals a day, breakfast, lunch, and dinner, and then there's always snacks available. They had the facility set up like a home as much as possible. There's a living room area with a TV and a computer and a telephone that's at their access anytime that they want to use the phone. They're allowed to have their cell phones from 7 a.m. to 11 p.m. They can use them at their free will. They don't have to ask permission to use the phone in the living room area. The rooms are kind of set up like a dorm room, but they have a nightstand and a dresser and a bed, and they give them comforters and, things like that. They discourage bringing anything from home due to, cleanliness, but they can have some personal items. There's a treatment room where there's group therapy, and then there's an evaluation room, like if you have to go in and do an intake, like if the police are involved or whatever. And then there's a community bathroom for women and a community bathroom for men. The kitchen is very nice. It's set up like what you would see in your home. The first day that I went and done my practicum, the woman there actually had fixed lasagna. And so it was very, very home feel as much as possible for what you can be, in a place like that. Also, there is a crisis center for a crisis hotline. It actually... to my understanding, it links to 911, and it's like a branch of the national suicide hotline, and someone is there 24 hours a day, 7 days a week. And I got to sit in a little bit with the 2 ladies who was working, and got to listen to. It wasn't very busy that day as far as phone calls. Of course, they explained that things like that come and go. But I got to there was a couple of phone calls that had came in, and I got to listen. And really, the first lady just needed someone to talk to. Not really sure what was going on there. She didn't really seem suicidal. I just think that she was just maybe kind of desperate and just kind of lonely for someone to talk to or whatever. But then there was a phone call that came in of a gentleman who actually did feel like that he had suicidal tendencies. He didn't really threaten that he was going to do it, but it was enough of a worry to warrant trying to get him to come in. They tried to talk him into maybe going to his local ER if he had any family, and then the lady done all she could to try to help him and try to get him to come in, and he ended up hanging up. So at that point, I'm not really sure what they did to try to get him back, but that was kind of an eye-opener to me that, that kind of was a little... kind of hurt me, to have to listen to that. Then a couple days later when I went back, and I went every day, but a couple days after this, I got the opportunity to sit in on an evaluation with my practicum supervisor of an 87-year-old lady who was brought in. Her son was married to this lady, and this woman was 87, and her son had passed away with cancer, and her daughter-in-law was causing some problems for her. And at this point, the police was involved. The daughter-in-law had said that she had pulled a gun on her. And so at this point, Johnny was explaining to me that we needed to evaluate her and see whether or not if it was a criminal issue or if it was a mental issue. Upon evaluation, I didn't really ask her anything, but I got to sit in, and he'd asked her birthday, the president, her address, and she was very coherent. She knew everything that was going on. And then she proceeded to say that the daughter-in-law had been coming up and harassing her because she wanted some of her things and her possessions. So when it was over, Johnny had asked me before he made his opinion what I thought, and I did not think that it was a mental issue, and he agreed that it was more of a criminal issue. So I was happy that I was able to make that, determination for myself. I felt like that my practicum hours and with the classes that I had taken prepared me for that evaluation, and I felt like, that I was comfortable doing it, and I was, according to my practicum supervisor, we were on the same page about what needed to be done. So that was interesting. And then there was one time that I met a lady there who they were trying to get on an involuntary stay. She did not want to stay. Her mom was coming and going, and she was so sure that she knew who I was, that I was a nurse that had taken care of her in the hospital years ago, which is not the case. So I just sat and talked with her like she was my friend, and then she would come back to reality. So at that point, they were waiting on the judge to sign off on having her stay. However, this facility only requires a 48 to a 72-hour stay. After that, they have to, think about further treatment somewhere else, or they let them go home. They administer their own medications there. There is a nurse on site, but everyone is trained to administer the medicines, and that's locked up. There's at least 4 therapists on site there. I'm pretty sure the way they said it, where they're open 24 hours a day, 7 days a week, there's 2 at all times there to be able to give these patients therapy when they need it, or because you never know, when they're going to have a moment. It could be a moment any time that they need someone, and so there's always someone there. They have a patio that's fenced in. They can't get out, but they can get to the outside from the facility on the inside. There's picnic tables and, an area for patients who smoke to go. That way they don't feel like they're being confined. And that was really nice. And I just felt like that if I were a patient there, I really felt like that I would get the utmost treatment that I could possibly get. I feel like that they really cared about their patients. I feel like they were very up to code legally, as far as the cleanliness, and as far as the facility itself, and as far as the care. I have to say that Johnny, my practicum supervisor, is very good at his job. He has taught me so much, and he has actually helped me decide where, maybe I would want to work in my career. I always knew that I wanted to be a therapist. I wasn't 100% sure. I know I wanted to give back to victims of families that maybe had, suffered some kind of mental abuse or physical abuse or drug abuse. But with him, I feel like that's something I would like to do, work in a facility that housed people, like inpatient therapy. I've learned so much upon my practicum so far there. I read the manual, and it was a very, very thick manual. I read it front to back, and I was enlightened on the rules and the regulations as far as, what's allowed and what's not allowed, and not just that facility, but as a whole. Like with this field, like what, as far as like confidentiality and things like that. I really am thankful that I was geared in that direction. As you know, my practicum fell through in the beginning of what I was supposed to do, but I'm so thankful that it worked out the way that it did, because I really I look forward to going and doing my hours. And I work in the guidance counselor's office at my high school, which is, I'm at work now. There is also a branch of Mountain Comprehensive Care. Riverside is for the adults, but there's also a facility called Creekside, and that's for the youth. It's under 18, and we send a lot of kids there ourselves. We have several students at my school who have been patients there, and Johnny actually told me that I could go there a couple of times, or as much as I wanted to, and get some hours in there to get an idea of on the more youth level of mental illness. I really feel like that's something I want to do as well. However, I don't want to make my students feel uncomfortable if they see me there and then see me at school. So I thought maybe I would try to work it out, and Johnny said he could help me, that maybe I wouldn't come in contact if there was any students from my school who were patients there. So that's something I definitely want to do in the next little bit. But I really love my practicum. I really love my center that I'm at. I feel like that he is definitely, by the time I graduate this fall and I get more hours in, Johnny is definitely going to have me prepared. I'm going to be ready, I think, to get out there and do this. He's made me feel like that what he does and where my center is at, that's a direction I want to go in. I want to help people is all I want to do. And I've been through a lot myself in my personal life, and I feel like that with my classes, doing those hours at that center, dealing with what these people deal with, and with my personal relationships, that I can relate to them, that I will be better suited for my job. And I'm very excited to get started as a social worker. And again, I love my practicum site. I understand my agency. I learn more every day that I go. And matter of fact, I'm going back. I'm going this evening. I'm going tomorrow, and I'm hoping to be able to learn the more of the forms that have to be filled out and signed off by the judge. He said that we would get more into that this week. So I'm excited to go back. I look forward to it every single time.